everyone, I hope everyone's having a great day today. In this week's homework, we are going to be discussing cancer prevention as one part of our larger June prevention series. In last week's homework, we discussed the prevention of metabolic syndrome. As noted this week, we are going to be discussing cancer prevention, and specifically we are going to be discussing the relationship between overweight and obesity and cancer. And in next week's homework, we're going to be discussing the relationship between foods and nutrition choices in cancer prevention. So today's video, we are going to be discussing what types of cancer are associated with overweight and obesity and the mechanisms belying kind of the increased risk factors that we see for cancer in individuals who are overweight or obese. So first I'm going to go ahead and speak to the specific types of cancer that we know have a direct link to overweight and obesity. So I'm going to go ahead and read this list. There are 13 cancers that we know have a direct relationship with overweight and obesity, and those are esophageal cancers, breast cancers, colon and rectal cancers, uterine cancers, cancers of the gallbladder, upper GI, kidneys, and liver, as well as ovarian cancer, pancreatic cancer, thyroid cancers, multiple myeloma, and meningioma, which is a particular type of brain cancer. When we look at the burden of cancer as a whole, we believe that about 15% of cases have a direct link to overweight or obesity. Some people might find this surprising, some people might find it not surprising. There's a pretty high degree of variance depending on the type of cancer, depending on the specific type of cancer and its specific kind of hormone status, meaning whether it's like receptor positive or not. It could be as high as 50% depending on certain types of cancers, but as a whole we look at a figure of about 15%. And when we look at why that is, a lot of it has to do with some of the long-lasting changes that occur as a result of overweight and obesity. So we often think of overweight or obesity as these sort of just like benign conditions or non-harming conditions characterized by an excess of body fat, but they're actually pro-inflammatory chronic diseases. And as a consequence of that pro-inflammatory state, a lot of kind of deleterious or harmful changes occur within the body that are oftentimes not noticeable until a diagnosis is made. And when I say not noticeable, what I mean is the person sort of living their life unaware that these changes are going along inside of them. It's not as though suddenly unhealthy cells start to replicate and all of a sudden it's like, ooh, I'm in pain. These things are often going on kind of under the surface in a way that the individual is completely unconscious of until the problem has become so severe that it does cause then at that point some sort of symptom, whether it's symptoms of things like fatigue, or sometimes pain is a symptom of something occurring, sometimes bumps, growths, those sorts of things. What I mean is on a sort of day-to-day basis, as these sort of genetic changes are happening that we see with cancer, it's not something that we're going to be aware of. And I think for many people, that's, you know, one of the more anxiety-provoking facets of cancer as a disease. So when we look at overweight and obesity as these sort of pro-inflammatory conditions, what kind of changes are happening and why are they happening? So when we talk about inflammation, I think a lot of people don't really understand what inflammation is. I think a really good example of inflammation is if you get a cut on your hand, even just like a paper cut, and it gets kind of red, right? That's inflammation. There are cells, specialized cells, that are being sent out to tend to that wound, and there's a brief inflammatory response. Things get kind of angry, they get kind of goopy, a little icky, and then our immune system goes in and it repairs those things. Inflammation is just a normal part of being alive. I think it's helpful to think about inflammation kind of like angry cells. And our immune system, again, is really tasked with kind of making sure that those angry cells are dealt with in a healthy and productive way. However, our immune system can only do so much. And so what will happen over time with pro-inflammatory conditions is the inflammatory load will increase to the point that our immune system can no longer handle it. And when that happens, genetic changes start to occur. We start to produce kind of some unstable molecules known as free radicals. And these free radicals, these unstable molecules, are kind of like wrecking balls. And they go in and they cause harmful genetic changes that allow unhealthy cells to proliferate. And that's essentially what cancer is. And in addition to that kind of pro-inflammatory environment where we have these unstable cells causing these genetic changes, we likely have some other things going on as a result of that overweight and obesity. So again, kind of that benign, what we think of as kind of a benign condition is really not as benign as we would like to think. Fat in and of itself doesn't just lie there, it is pro-estrogenic, meaning it is producing additional amounts of estrogen and hormones that mimic estrogen. And that sort of alteration to the hormonal environment can just amplify the rate of cancer growth. We see changes in things like insulin-like growth factor, which is a hormone that also contributes to that same process. And we see long-term changes in both insulin-like growth factor and our sex hormones. When I say long-lasting changes, essentially what I mean is because we never lose fat cells, they actually just shrink down in size. Even once an individual has lost weight, those that sort of biological state is still going to persist to a degree. Like we've talked about, overweight and obesity, they're lifelong conditions. Even if someone is at a reduced body weight, their metabolic system as a whole is just different than it would be if they had never gained weight and then had to lose it. However, we do see reductions in cancer risk as somebody loses weight, even if they're still going to be at slightly higher risk than they would be if they never experienced overweight or obesity to begin with. I think it's really important to affirm and kind of reinforce the notion that positive change is always going to lead us to more positive outcomes than we would be receiving otherwise if we were to just kind of throw our hands up and go, well, what's the point in even trying if I'm already at an increased risk? If you're already at an increased risk, you probably should be trying even more. It might not get you the exact outcome that you'd like, but the reality is I believe 1 in 8 individuals will experience a cancer diagnosis in their lifetime, and anything that we can do in the name of prevention is well worth it, not just in the essence of cancer prevention, but also in the essence of promoting longevity and promoting quality of life. I hope that something from this video stood out to you guys. Go ahead and answer the prompt above for today's homework, and I hope you have a great rest of your day. Thanks, guys.